Method 3-7, detecting antibodies in the presence of rouleau, known as saline replacement. If you can spell rouleau, you're probably a blood banker. The principle of the saline replacement method begins with when a patient's sample is abnormal due to concentrations of serum proteins, altered serum protein ratios, or high molecular weight volume expanders. These items can aggregate reagent red cells and mimic agglutination. Rouleau are red cell aggregates that adhere along their flat surfaces, giving a stacked coin appearance microscopically. Rouleau can cause confusing reactions during an antibody identification workup and or cross-matching and using tube method. The presence of rouleau is often first observed macroscopically as pseudoagglutination. The presence of rouleau is then confirmed both microscopically and using the saline technique. An indication of patients with high protein ratios can be determined also by medication or diagnosis, such as patients with multiple myeloma have high levels of protein. From my experience, rouleau is typically weak in strength and is often observed at immediate spin only. The technical manual indicates that rouleau formation is not observed in the IIT phase of testing because the washing steps remove the majority of implicated plasma proteins. Sometimes rouleau can be suspected through a process of exclusion when other methods continue to have agglutination at immediate spin. To begin the procedure, you'll need to first suspect that rouleau is occurring in your test system. So in this scenario, we have reagent red blood cells, and we're going to add patient plasma to a single tube. So this tube system will have reagent red cell and patient plasma. We add 2 drops of patient plasma, and then we'll add 1 drop of the reagent red blood cell. We'll then spin the mixture for 20 seconds, typically, depending on how the centrifuge is calibrated. The red cell plasma mixture will be agitated to dislodge the red cell button. And with rouleau, you'll see a very weakly reactive agglutination, pseudoagglutination pattern, which you'll confirm under the microscope as stacked coin appearances. When you suspect rouleau, you'll want to take a small amount of the mixture and add it to a slide to observe microscopically. This is a picture of rouleau formation. As you can see here, we have these stacked coin-like appearances, which is characteristic of rouleau formation due to the high level of proteins. After you've observed agglutination and confirmed the presence of stacked coins under the microscope, you'll take your test tube system containing patient plasma and reagent red blood cells, and you'll recentrifuge the cell mixture. Saline can be added to a separate test tube during your spin. Once the centrifugation is complete, you'll remove the patient plasma, as shown here, leaving behind a red cell button. You'll discard the patient plasma and you'll add 2 drops or an equal amount of saline. You'll then resuspend the red cell button through gentle agitation and you'll observe for agglutination. Rouleau will disperse when suspended in saline, while true agglutination remains stable. In this scenario, we've confirmed the presence of rouleau since the agglutination dispersed after saline technique.